Hello, welcome to the presentation, Student Health, Mental Health, and Insurance. This is going to be a quick, broad overview of some of the information that you would want to know about these topics concerning your health and the health resources on campus. First, I should say that University Health Services has a substantial website that has a lot of this information on it. So if you go to sc.edu and search in the search bar for Student Health Services, University Health Services, it will pull up their website and there are many, many resources available. So this is a quick overview that I'm going to give you today. First off, this is our Student Health Center. It is the Center for Health and Well-Being is the official title here. It is a few years old now, but it is a wonderful building. It's brand new, and you can see doctors, there's a pharmacy, they have wellness classes, the allergies and immunization clinic that a lot of the new students, you'll need to go and get your immunizations taken care of and cleared. You'll go to this building. It is located directly behind the Russell House and to the left of the library. So it's right in the middle of campus. You go in the front. If you have any questions about where to go, there's an information desk right up front, and they'll be happy to help you. So this is located right behind the Russell House in the middle of campus. So Student Health Services, they provide comprehensive physical and mental health care services on campus. They are professional, compassionate. They have a lot of things there to offer for you and to support you and make sure that you are happy and healthy while you are here. That's the contact information right there. Again, you can find this on their own website. So the health center, as I mentioned, is located behind the Russell House. Most appointments are free. As students, you pay a student health fee, which allows you to go see a doctor for free. There is a pharmacy there, and like I said, lots of different things, general testing, general appointments to speak to a physician. They're all there. Now, some things will cost money. If you need to have further blood tests or x-rays, things such as that done, those will cost some money, but even then it's at a substantially reduced cost for students as to what it would be in other places. They also have campus wellness where they have nutrition and exercise consultations, tobacco cessation programs. So if you smoke and would like to quit, which you should because it's unhealthy, you can get help there, stress management, all sorts of things to support our students. Here's a list of everything that they have there. Allergy shots, counseling and psychiatry, immunizations, interpersonal violence support, lab tests and screenings, LGBTQ health, nutritional courses, physical therapy, primary care, radiology and EKG, sports medicine, travel clinic, women's health. You can get all of this done right here on campus as a student. All right, so if you have a medical incident or an emergency, the health center on campus is not equipped to have people, you can't stay overnight there. It is not a hospital, it is a clinic. So if you have a life-threatening emergency, you can call 911 and they will take you to the nearest emergency room, or ER is what people call them for short. Do not go to the emergency room if your condition is not life-threatening. If you just feel like you have a cold, then you want to make an appointment and talk to somebody at the health center. If you have a headache, you're not feeling well, that's not a time to go to the emergency room. That is if you are bleeding or if you are, real life-threatening situation there. Life-threatening situation, that's when you need to go. Or if something's wrong and you don't know what it is and it is very serious, that's when you go to the ER. If the health center is not open, you can go to an urgent care center for severe, but again, non-life-threatening emergencies. For regular checkups, you can go see the doctors in the health center if you want to make that your primary doctor. And then if you do have any major medical incidents or an emergency, please contact the ISS office so we are aware of it. You don't have to call us first. Call 911 first. Go talk to your doctor first, but do let us know if there's anything happening. We can assist you, and also it's good for us to know how we can support you from an immigration perspective as well. Healthcare in the United States, I'm going to talk about a couple of basic concepts right here. So first of all all international students on USC's campus have to have health insurance. That is a requirement. So why is this a requirement? Why is this important? We don't have free healthcare in the United States. Everybody needs to have insurance. You have to pay for your own healthcare. We do not have national plans that you find in other places around the world. Medical care is very expensive in the United States, and so insurance can help lower the costs if you do have any unexpected injuries or illnesses. And again, it is a requirement for students to have it if they are going to be attending USC. That's for most all students, actually. So unless it's an emergency, you should go to the health center first. Again, the health center, our health insurance, the university's plan covers most everything that you would need to see a doctor for an initial consultation. Even other plans that don't cover as much as the health center do, they do still cover some of the costs on this. So you may be required to pay for services and be reimbursed. That's something that surprises a lot of people. But if you do have to pay up front, you can submit your receipts and then the insurance company will reimburse you the money that you have spent. And again, I said this before, if you have a non-urgent health concern, we do recommend that you go to the health center first. It is your cheapest option as a student. You have to have health insurance, but you are able to use another plan if you do not want to use the Blue Cross Blue Shield plan that is offered through academic health plans. That's the university's policy. You can use another plan. Now, the USC Blue Cross Blue Shield, it covers you worldwide from now until the end of the semester. It always starts on the beginning of the semester and runs till the end of the semester. You can waive this by going to the AHP website. If you go to the university's website and select and search for insurance in the student health services pages, then it will take you to detailed information about that. The ISS website also has information about how to do this as well. We're waiting to get the final information for the policy for this upcoming year, but we will have it up soon. If you do not waive the insurance, you are going to, or if a waiver, you submit a waiver and it is not approved, you are going to automatically be charged for health insurance for the fall. So keep that in mind. This is not something that you could ignore. If you ignore it, you're going to be charged regardless of whether you have other insurance. To do the waiver, these are the steps. I'm not going to go into great detail. All these steps are available on the Health Center website, and then you go to the actual site. But you can go to sc.myahpcare.com. That will take you, it will give you the option to select that you're going to waive. You're going to submit your policy information. If your policy does meet the requirements, you're going to get a message that says that you are waived, and that bill, the charges will be taken off of your student account. If it does not meet requirements, you're going to get a denial notice. You may be asked to provide additional proof of coverage. Many policies are denied at first, but they may be approved later if you can provide additional proof of coverage. So you should do this as soon as you can. If you purchase the U of SC health insurance, but your waiver is later approved, so if you do a waiver, but you've already purchased the health insurance, you will be reimbursed, but that can take up to 6 to 8 weeks. That's not an immediate thing, but you will get reimbursed if a waiver is approved. If you have any questions about reimbursement, you can contact the bursar's office. That's their contact information right there. They handle all of the money issues for the university. So if you have any questions about that, that is taken care of in the bursar's office. Couple simple terms to know that are good for new folks to know. A co-payment. This means that it is a specified dollar amount that an insured person must pay for specified coverage or covered medical expenses. So if you go see a doctor that's not the campus doctor, or if you have a non-USC insurance policy, may have coverage, but they may say, okay, you're going to have to pay $15 today. So it's very common that even with insurance coverage, you're going to have to pay some what we call out-of-pocket expense. Now, that's defined down below. Out-of-pocket cost is the cost that you must pay. Out-of-pocket costs vary by plan, and each plan has a maximum out-of-pocket cost. You need to consult your specific insurance plan for more information. Going back up, a deductible, that is the dollar amount of covered medical expenses which must be paid by each insured person before benefits are payable under a policy. So if you have a $1,000 deductible, that means that even though you have health insurance, you have to pay $1,000 of your own cost before the insurance will begin to start covering the costs. So you're going to have to pay $1,000, and this doesn't have to be all at once. If you go to the doctor, you know, if you're spending $200 to see a doctor, you're going to have to go see that doctor 5 times for it to add up to 1,000. And at that point, then insurance will be covering. This varies by insurance plan. So you're going to want to see what your insurance plan has. If you are from another country that does not have deductibles and you're looking at this and saying, oh my gosh, I cannot believe that. Welcome to the United States health system. It's frustrating for all of us that live here too. A premium is the payment that you make to your insurance provider to cover, to keep your coverage. So this is like, this is the cost of having an insurance policy. You pay your premium up front. If you're going to get the university insurance plan, you're going to pay that up front. You're not going to have to make monthly payments because you pay a semester at a time. So you pay the whole cost for the semester up front. But if you have other insurance plans, there may be a monthly premium where you are charged by the month. And it's just going to be a regular expense that you have. All right, other health matters. Students identify that stress is the #1 impediment to academic success. School is stressful. Living in another country is stressful. Going to school while living in another country is stressful. So we point this out not to stress you out more, but to say that it is normal to feel stress. We want you to be healthy while you're here. So when we talk about health, in some places, some contexts, different countries, when we talk about health, you're talking about, do you have a cold? Do you physically feel well? But in the United States, when we talk about health, we are very often talking about physical health, emotional health, and mental health. We consider this to be holistic. This is all part of who you are, and you need to be healthy in all of these areas to do your best and to succeed academically, which is, of course, what we want you to do. We want you to have a wonderful time here in the United States, but you are here to study. So obviously, the goal is for you to get that degree, and we want you to be healthy. Student Health Services is a resource for you. I've listed all those different things that they've said that they do on that list earlier. Those cover a variety of different things that you're going to need to take care of. So I want to talk here a little bit about mental health services. All that stuff above applies to physical health, but mental health is also a large component of what makes a successful student. So we know that sometimes this is a taboo subject. There's some stigma to this. If you're talking about mental health, you're talking about, you don't want someone to think that you're quote unquote crazy, but that is not what we are talking about. We're not talking about only severe mental health issues, which of course some people do have, and those can be addressed and treated on campus as well. We do have a counseling center and a psychiatry center, but you can look at this list right here. You can see what we talk about: emotional wellness, environmental wellness, financial wellness, intellectual wellness, occupational wellness. These are all part of these are all part of your life that goes into that stress and how well you're doing. And so we really recommend that you take advantage of the mental health services that we have on campus. And don't think about mental health in terms of like, oh, am I doing well? Am I a good person? Am I a crazy person? That is not what we are talking about. I want you to think about mental health as one of the pieces that goes into your successful academics. If you need to go talk to someone about stress and that helps you to make that A on that next paper that you're writing, go for it. That's what they are here for. It's all geared to you being happy, healthy, and successful. We do have counseling services here. It is located in the Thompson building, which is actually connected to the new building. I showed you that picture earlier there. The building is connected. It's the building right next door. They have individual and couples and group counseling. They have biofeedback. They have community-based services. There is suicide prevention training. There is always someone that you can talk to. If you have a non-emergency issue and just want to chat with someone about things that are stressing you out, then you can make an appointment. You can go see a counselor and you can talk about that. If you're having a more serious concern, you can do a walk-in to the counseling center right there. Their hours, they're open general business hours, but they have someone on call 24/7. So that same number right there, that 777-5223, that's a number that you can call at any hour of the night and you can be connected with someone that can talk to you right then and there if you are in need of support. Thank you. That's what we're going to cover today. There's a lot of topic. Health is a big topic, and that's why I suggest when you get a little time after you've watched this, you get a little time and you're getting settled in, go to the health services site and look at the things that they do. Not only, I talked about the services that they provide, but they have a lot of programming and really fun things too, nutritional classes, meditation and yoga and all sorts of things. They do all sorts of things that are really fun activities as well. So take advantage of that once you get here. And we look forward to seeing you soon. Thank you so much.